experience altogether, pursue other educational options, a little late for that, or send them to school in masks and redo the experiences of last year. These are all bad options, in my opinion. My kids will be at school on Monday in masks if that's what you continue to require them to do, because I'm not going to further their exploitation as pawns in this political game. Instead, I'll stand and fight here because I still believe Alamo Heights Independent School District is the best school district in the state of Texas, and that we can once again be a place where all parents, all members of the community's opinions and decisions are respected, whether it's with respect to masks or other educational decisions. After 18 months, we arrive at the same place where we started with our COVID response. Perhaps this realization is the largest indictment of the futile efforts we've made to mitigate a respiratory virus that poses little to no risk to kids, at least of severe outcome. God forgive us our arrogance, expecting we could eradicate a virus. However, I'm not here to debate scientific or medical opinions. What I'm here for is for the respect of all parents to make decisions for their kids' health and safety. For the second school year, Alamo Heights spent the summer developing a plan to return to school safely. For the second school year, this plan was communicated to parents throughout the summer, building expectations for the coming year. And for the second school year, we relied upon these expectations only to have plans scrapped at the 11th hour by bureaucrats and politicians. The Alamo Heights plan respected the diverse views of our community by placing decision-making authority for children's health and safety in the hands of parents. This is not a radical position. I continue to believe it presents the reasonable, best path forward. I urge you to reconsider your position, as other school districts in the city have done recently, and choose individual choice over blanket mandates. You have the authority and the opportunity to do so if you act now. We elected you as stewards of AHISD, not Bexar County Metro Health Authority. So we look to you as advocates.
Thank you, Mr. Sharple. Thank you. Anna Romo is next. Tim O'Sullivan, you're on deck.
Well, I want to extend my appreciation to the board, to our teachers, and to all of our administrators who I'm sure didn't expect we're going to have to deal with such a difficult time and with a public health crisis. I'm here as a parent of a child at Woodridge and another at junior school, and I'm here to ask for continued mask wearing, even if the city's case fails. And I'm here to show you that you have parental support to make these tough decisions, and others needed to protect our children from a surge of this new wave of COVID and this more dangerous variant of COVID. I want to make sure that we as a district embrace science, not politics, and I want to make sure that one of the most important rights, the right to an education, is respected. My husband and I have spent the last weeks trying to figure out if we can homeschool our children, if we can put our careers on hold, if we can afford to send them to private school. And if we've been trying to calculate the emotional toll of taking our daughter out of her first year of middle school, keeping her at home, giving up Spanish immersion. And we've been disappointed so far in how school leadership and a lack of a firm policy on masks has forced people into choosing between health and education. UT projections for Austin have predicted if schools open without masks, hospital capacity will be exceeded in 2 weeks. We have the tools to keep kids in school in person. These tools are leadership and science-based policies, including masks. Our kids need you to use these tools, and I need you to use these tools for our kids. Thank you very much.
Thank you, Ms. Romo. Mr. O'Sullivan, you're next, and Emily Wan, you're next.
Thank you for the time. Thank you also for moving this meeting outside. That's much appreciated. I'm speaking on behalf of my family, including my 11-year-old at the junior school and 9-year-old at Woodridge. As of August 5th, 200 Texas hospitals that report these statistics, a quarter of them had no more room in their ICUs, and that was 1 week ago. An 11-month-old with COVID was airlifted out of Houston, Texas, and flown to Temple, Texas, because there was no room in any pediatric hospital in that city. Now, the CDC recommends universal indoor masking in high transmission areas, which is defined as an area with over 10% positivity rate on recent COVID tests. Most recently, data in Bexar County suggests that we have a 21% positivity rate on those tests, which is close to our highest positivity rate in this whole saga. So I'm here today because I'm concerned, frankly, about the language coming out of this district suggesting that we should respect the choices of families about masking, as if our choices only impact our individual families. They do not. Those choices impact my family. Those choices impact everyone in this district's family. And this is not just about COVID, if you think that COVID has been overblown. What if your child has appendicitis next month? What if your child has emergency surgery on a broken arm? And yes, what if your child gets a severe case of COVID? This is nothing to say of the torture we've been putting doctors, nurses, and hospital staff through with this recent surge. Now, some would say that these decisions are best left by school district. Fine, but last I checked, we do not have sufficient hospitals or emergency rooms in our school district to serve our population. Again, our decisions don't just impact our families or our district, they impact our whole community. So this is not just about Abbott's executive order or the new Metro Health mandate. Mandate or not, masks and vaccines should be encouraged by the teachers of this district, by the staff and administration, by the Board of Trustees, and by the superintendent. Yes, it will not be a popular thing to say, and you will make people angry. But until we get over this fourth surge, it is the only responsible thing to do. I don't want to live in a city with no capacity in its hospitals, and I doubt anyone in this district does either. Masks and vaccines will get us over this hump, and I'm asking you all to start actively encouraging their use, regardless of local or state ordinances. Thank you for your time.
Thank you, Mr. O'Sullivan. Emily Wong is next, and then Jason Bowling, you're on deck.
Good evening, school board. My name is Emily Wong. I'm a parent of a 9th grader in the high school and a 6th grader at Woodbridge. I have been a physician since 2000. I am a clinician teacher at the Health Science Center. I teach medical students, I teach residents, and I take care of patients at the Veterans Hospital. This has been the hardest thing that I've done in my 18 years of my career as a practicing internal medicine doctor. I am tired of taking care of COVID patients and telling their family members, ma'am, I'm sorry, I need to upgrade your 39-year-old healthy husband to the ICU to be intubated. I'm tired of holding an iPad so the wife can say goodbye to her husband who is intubated and dying of COVID. This surge is different. This surge has limited our bed availability. Patients, veterans, are being turned away from our hospital because the hospital is full, whether or not they're coming in for a COVID infection or they're coming in for treating their diabetes or treating their COPD or treating anything else. This is the difference with this surge. I have taken care of patients, 39 years old, FedEx truck driver. He wants me to tell him, his wife wants me to tell him his 6-year-old is looking forward to for him coming home, but he's been in the hospital for 3 weeks, unable to go home because he's still on high flow oxygen. I have to tell the 67-year-old retired pastor that he's not doing better and we have to send him to the unit. I have to tell the 40-year-old who's otherwise healthy that he can't go home either, even though he's been asking me for the past week. I applaud the Alma Heights board and superintendent for your healthcare protocol measures. My two asks are: one, regardless of the hearing or the decision on Monday, that we continue to mandate masks for everyone, students, staff, faculty who come on campus. And number two, to encourage vaccinations, because this is how we can take care of our children who can't be vaccinated, our family members, our grandparents, our friends, our community. Thank you.
Thank you very much, Dr. Wong. Jason Bowling is up, and Eric Cruz, you're on deck.
Hi. Hi, can you hear me? Hi, ladies and gentlemen of the board, I appreciate the opportunity to speak with you. I'm an infectious diseases physician. I'm also a medical director of infection prevention at University Hospital and UT Health San Antonio. Since the beginning of the pandemic, I have been very busy seeing patients with COVID-19, but also very busy helping organizations develop infection prevention protocols so we can keep our providers, patients, students safe during this pandemic. This was including before the COVID-19 vaccine was available. We're in a different time now with this pandemic. This Delta variant is the most transmissible strain we've seen so far. With the prior strain, a person could infect about 2 to 3 people. With this current strain, the Delta variant, we could see somebody infect 6 to 8 other people. The other thing that we're seeing clinically is that the symptoms people have with this Delta variant are very mild. They may have some sinus congestion, runny nose, think that they have seasonal allergies, but actually have COVID-19. They also become transmissible to others very early on. Before, from exposure to infection was about 6 days. Now that can be about 3 to 5 days. And so people pretty quickly can be infectious without knowing it. So when we talk about responsibility, it's hard to hold somebody accountable for transmitting disease to other people when they're unaware they're infected. It's a real challenge. How do we approach this problem? The way we can approach it is to use mitigation efforts that we know are effective. Universal masking has been effective. It's kept our providers safe before we had a vaccine. Back when our diagnostic test took several days to return, the way that we kept our providers safe and able to care for more patients was by wearing masks. We've been able to successfully use masking in our medical school for our patients and our students so they can see patients with COVID-19. So the importance of masking is really paramount. I'm asking the board to follow the science-based measures of mitigation, which include masking. The other measures that were effective for in-school training this past year. One of the things what we all want is in-school learning. We know that's better for children. One of the benefits for having been in this pandemic for so long, and I think one of the key points that's already been mentioned, and I think it's important to reiterate, I agree with the board's context of this, framing of this, no one's responsible for this pandemic. This is a horrible virus. There is an ABC Science Collaborative that is NIH funded, coordinated by the Duke Research Institute, and it's 13 states involved. They have looked over what worked, what didn't work for the cumulative experience during this pandemic in schools to keep K through 12 students in schools. One of those things it showed was that when you're in a community with high transmission and low vaccination rates, is that masking would still allow students and teachers and staff to stay in the school without secondary transmission of infection. I highly recommend using this document. I'd also be willing to volunteer my time to help with infection prevention protocols as needed moving forward. Thank you for your time. I appreciate the opportunity to speak with you all. Have a good evening.
Thank you, Mr. Bowling. Eric Cruz, you're up, and Kara Vandekitt is next.
Dr. Bashara, Dr. Walker, Dr. Alfaro, the Alamo Heights School Board, thank you so much for the opportunity to speak tonight. My name is Eric Cruz. I am president of the Alamo Heights Education Association, the local chapter of the Texas Teacher Association and NEA. We stand on the precipice of a new school year. In a few short days, campuses throughout this district will welcome back students for another year of learning, for another year of character development, and the creation of memories that will last a lifetime. I can tell you that we are all looking forward to seeing our kids. But what I want us to reflect on tonight is what makes this district exceptional. Our teachers, our paraprofessionals, our custodians, our campus administration, our district leaders, our community, which encapsulates our students and our parents. All of us make AHISD a great place to work and to live. Here in AHISD, we are all part of a legacy. This legacy is certainly one of academic success and personal accomplishment. But this legacy is possible only if all of us acknowledge and cultivate the larger gift of this space. The fact that we are one community. I believe that we are bound to each other in a common purpose and a common dream. The betterment of our children and of our community. The deepening of our humanity as a result of honest engagement with one another. And the furthering of this great democracy in which we are all fortunate to live. Our common bond is essential to our identity as a community, and it is essential to the possibility of who we aspire to become. This bond insists that we listen to one another, that we have hard but necessary conversations, and that we seek not an absence of disagreement, but an abundance of compassion, of patience, and a willingness to truly understand and acknowledge complex issues. This year, there may be instances where we have disagreement. Different parts of our community may disagree. This can be healthy if we avoid, as a community, the premise that the person who disagrees with me is my enemy. This teacher association, which I am honored to lead, commits to this board and to this community an openness to converse with you in a respectful and open way, no matter where our interests converge or diverge. AHEA stands ready to support and engage with our board, our district administrators, and any member of the community. Thank you all for the tremendous work you are doing and for listening to AHEA's statement tonight. I wish all of you a great start to the new year.
Thank you, Mr. Cruz. Tara Vandekipp, and then on deck is Carolina Garza.
I'm Dr. Tara Vandekieft. I'm a physician specializing in diagnostic radiology. My children attend the junior school, and my husband, who's back there, is a pulmonologist, and I've lived in this community for over 15 years. We are here tonight to advocate for policies that not only ensure our children's safety, but also the safety of every child, educator, and family in this district. Children and young adults are not immune to COVID-19. As a radiologist, my patients with COVID-19 don't talk to me, but their chest x-rays do. Right now, they tell me a story that no one wants to hear, and it doesn't always have a happy ending. My sickest patients are unvaccinated young adults and kids as young as 1 month old. Many who are the same age as our students, staff, and recent graduates. Every day, I look at chest x-rays on 20-year-olds, people in their early 20s, whose lungs have been completely destroyed by this virus. They will not live without a lung transplant. We have had over 400 pediatric deaths in this country from COVID-19 since the start of this pandemic. Unfortunately, there are surely more to come because transmission due to the Delta variant is accelerating among this age group, driving pediatric hospitalization rates across this country to an all-time high. This is publicly available data. Now is not the time to deviate from strategies that we know work to stop the spread of this virus, especially if we care about protecting our unvaccinated children. We support universal masking in public schools. We do not support any attempt by members of this community to compel the superintendent or the board to use district resources to overturn the county's public health mandate. Thank you for your attention.
Thank you, Dr. Vandekieft. Carolina Garza, and next up is Aaron Fabalania. Sorry if I butchered that.
My name is Ana Carolina Garza. I'm an ICU doctor. I'm a pulmonologist. I work at the main Methodist Hospital at the Medical Center. Hello. I've been taking care of COVID patients since March last year, and I can tell hundreds of stories. My kids go to Cambridge Elementary, first grader and a fourth grader, and I love this community. I work in a group who's covered 5 hospitals in the city, and I love my profession, my patients. I'm dedicated to my work. I just want to share what we doctors are experiencing today. We are tired. We're reaching capacity. We don't have beds. All our ICUs are full. We're creating beds that are not ICU beds on the floors that doesn't have those glass doors, so we cannot even see the patients. If the patients are struggling to breathe, we cannot see it. An ICU doctor takes care of 20 patients, 15 to 20 patients. 20 patients is a lot. Now we're seeing up to 40 patients. We cannot deliver good quality of care in these situations. We see patients with stroke, not only COVID patients, we see patients who have strokes, heart attacks, pneumonias, sepsis, other things that are not related to COVID. We cannot make good medical decisions in these circumstances. We are tired. We are begging for help. Texas is experiencing a high rates of burnout in ICU doctors. And the Children's Hospital, also the ICU is full. They don't have beds for pediatric patients at this point. So we have to take care of our pediatricians, and we have to take care of our children. They deserve the best care. Those who are at risk, those kids who have asthma, who have heart conditions, our toddlers whose immune system is not well developed. Please think of us, doctors and nurses, and we all deserve good quality of care. Thank you.
Thank you, Dr. Garza. Aaron Abelania, Matt Kroll, you'll be next.
Good evening. My name is Aaron Fabilena. I am a data scientist, and I've worked in operations management and workforce management. Very familiar with standard operating procedures, as well as how sometimes being in a certain position or field might give you some narrow vision in terms of the big picture and what's happening. As a data scientist, we're taught to take a step back, look at the data, analyze, ask questions. And if we don't have good answers to those questions, we don't jump to what we've been doing. Oftentimes we scrutinize what we've been doing, and we try to look for alternatives. We try to look for different ways in which we can combat whatever issue it is that we're analyzing and dealing with. And one of the things that really just weighs on my heart and has prompted me to come here and speak is I feel like as a data scientist, I'm seeing us do the same things over and over again, expecting different results. I was told early last year that we were going to flatten the curve in a short amount of time by doing social distancing, wearing masks, and doing these things to help protect one another. And I believed in that 100%. I was wearing a mask, I was social distancing, I was doing everything I could to help protect my community. And I think it's important, to try these things and to also to look for alternatives, and also look to science to help explain this. But one of the things that I think is important for us to understand is there's been a lack of scientific research into this. It's very specific and very narrow in which the path in which we have tried to solve this problem. And I don't see very much funding, and frankly, the conversation isn't really allowed for alternative researches and alternative methods in which to mitigate the health concern that we're all involved in here. And something that's interesting is, in Massachusetts, the CDC had a report that they just generated last month. 74% of the cases of COVID-19 in Massachusetts were from vaccinated people. Contrary to what all the science and everybody is saying. In addition to that, the CDC released a statement within the last 2 weeks that they can't actually differentiate between